What you need actually is a vertical maxillary reduction.
We do a minimal work on the right angle.
I'm having some treatment done for my asymmetry on my face. Yeah, I'm feeling good.
So this is the second day of her surgery. She's on her liquid diet as of now.
Thank you very much. I appreciate it. Dr. Sunil, very good.
So as you can see, even the swelling is gradually reduced.
Yes, everyone's been so lovely and friendly. I've had a great experience. Hi, how are you?
Hey, doing well. Tell me, what can I do for you now?
Basically, you know the rhinoplasty?
Yeah.
Can you get me the results I want, do you think?
Yeah, I've mentioned 5 things we can do.
Yes, so I've got them all here. So it's
Ah,
the
okay.
genioplasty, the angle
Osteoplasty. Yeah.
the rhinoplasty, the buccal fat removal, and then
Yeah.
you can do a bit of lipo. And
That's going to happen the same time I've mentioned, at the same time as we do genioplasty. And I've said 5 millimeters horizontal only, and we're going to do minimal liposuction.
Do you think 5 millimeters is a lot on my face?
No, it won't be a lot. See, because we have to consider the fact that you've given fillers.
I have fillers, yes.
Yes.
Like, I did my
And on the
fillers.
scan, it doesn't look more 5, it looks minimal.
Yeah. Well, how much do you think you should do it then?
Minimal, 5 is enough.
I don't want more than 5, but I mean, like,
No, I won't do more than 5. We'll do
whatever
5.
you think looks normal.
I think 5 is what we decided from the scan, so we'll stick with that. And also,
4, I think you said.
I've written 5. Yeah, we can do 4 if you want. 1 mm, I can do
Yeah, it
less.
doesn't really matter that much. But yeah, okay. Hold on. You know the filler?
Yeah.
Is one, yeah, I guess it's 1 millimeter. It's
1 cc.
1 cc is 1
See,
millimeter.
the filler problem is we can't correctly predict the amount that's there. But when we look at your scans, the chin is really, I mean, it needs augmentation for sure. This is not your scan, but we can go to yours. What you need actually is a vertical maxillary reduction. Because when you showed me those pictures, and also the scan, you have a mild, maybe 3 to 4 or 5 mm of vertical maxillary excess. And that's why you feel when you smile, that's when you see on the sides and everything, it makes the face look a little bit longer. But that's a bigger surgery. I would not personally recommend it also for you.
No.
But that's what you have to understand,
Okay.
that there is an underlying anatomical issue or rather imbalance, which we're not willingly wanting to address because it might change the aesthetics or your facial balance in a not so nice way. And you're tall, you're well built, and so it doesn't matter if you have a little bit of a gummy smile. That's one point. The second thing is, see, when you rotate the upper jaw, the nose also gets affected a little bit.
Yes.
It does get affected. I do what is called as a concomitant rhinoplasty to make sure that the nose doesn't get affected if I have to,
Yeah.
or if I want, I do it in such a way that the nose gets a better shape as what we want. But still, you have to understand when you do any upper jaw surgery, the nose, without an exception, gets affected because it's on the upper jaw.
So we have this patient here. She came to us with a complaint of mild asymmetry on the right side of the face. So what we have planned for her today is a genioplasty. We'll be doing minimal advancement in vertical and in horizontal direction, as well as the angle osteoplasty. If you see the angle compared to left side, it is going in. So we're doing minimal work on the right side. Can you please turn on the right angle, and also the fat removal, the buccal fat removal from bilaterally. So it's going to give a slimmer look by doing that. So it's going to be a genioplasty, the advancement genioplasty, along with bilateral buccal fat removal and the minimal work on the right angle region. We're going to start this procedure in a while. Thank you.
I'm a patient here at the Richardson Hospital, and I'm having some treatment done for my asymmetry on my face. I'm hoping to just have a bit more of a slender look, and yeah, just to feel a bit more confident in my own skin. And I'm expecting great things from this hospital because I've heard great things and I've seen great things, as I'm sure you guys are seeing great things now. But yeah, that's it really. Thank you.
Yes.
So hi Malika, how are you feeling?
Yeah, I'm feeling good.
So she has come. So she has come for us with the chief complaint of facial asymmetry. So we have done advancement genioplasty and right angle osteoplasty and buccal fat removal. So did you have? Are you having liquid diet?
Yes.
So what did you have now?
I've had lots of chicken soup. I've had lots of pomegranate juice and ice cream, which has been delicious.
Cool. So so this is her first day of her surgery, and as of now, she's feeling fine, and she's on her liquid diet, and yeah, we'll follow up her. So hello everyone. So this is the second day of her surgery. So we have done genioplasty, right angle osteoplasty. So as you can see, there is a bit of swelling and she's keeping her eyes back as of now. So which is going to reduce gradually, and she's on her liquid diet as of now. So how are you feeling?
Good?
Good?
Yes. Only liquid diet.
Only liquid diet. So she's on her liquid diet, and we'll follow her up until 5 days, okay?
Okay, sounds
Thank you.
good. Thank you very much. I appreciate this. Dr. Sunil, you're very good. But this is not going anywhere.
Everyone, so she's Malika Reza. So we have done genioplasty and right angle osteoplasty to her. And how are you feeling, Malika?
Good, yeah.
So this is her fourth day of his after her surgery, and yeah. What are you having today? What did you have today for lunch?
For lunch, I just had some soup.
Mm.
Vegetable soup was very nice. I ordered it on Zomato. And I had some coconut water, and I'm going to get some juice in a bit.
Yeah.
Yeah, all liquid foods.
Yeah, very good. So as you can see, even the swelling is gradually reducing. You can see her result. Obviously, there is a little bit of swelling which is going to reduce. So she's Malika. So she has come for us for her genioplasty, and we have done right angle osteoplasty, and we have also done buccal fat removal for her. And how are you feeling, Malika? So today is her discharge. This is the 5th day of her surgery, and how after her surgery, how are you feeling, Malika?
I feel great. This lady has been absolutely amazing to me, this Dr. Shruti, and yes, everyone's been so lovely and friendly. I've had a great experience. It's obviously very hot in India. That's the only difference to my natural kind of climate. But besides that, it's great, and I would recommend this practice to anybody and all these lovely doctors.
Because we're planning to let you go. It looks beautiful. It's perfect. It's perfect.
Okay?
Yeah, you're good to leave. It's perfect. So do remember, because we've done all the surgery from inside the mouth,
Yes.
you got to take care of your oral hygiene.
Yes.
You have to keep it clean so there's no infection.
Yes.
And then you also have 2 plates. We can show you that. This looks a little exaggerated now because of the filler. So when we did the surgery, we saw the filler inside.
Yeah.
We didn't remove it because
Yeah.
sometimes it doesn't come out cleanly or
Yeah.
neatly. So we just let it be there. It's not going to go away anyways.
Yeah.
It's going to resorb. in the next few months. So then you're going to be left with a nice chin. That's going to be there for permanent.
Okay, fine.
And what's your plan now? You said you're going to come back after a few weeks.
Back to you. I'm going to wait until the end of this week.
Okay.
And then early next week, maybe Monday, Tuesday, I'm going to get in contact with Rijo again and come and maybe see Sarah about my teeth. We have to obviously talk about this.
Hey, but your gums have healed as well.
Like, it looks really
Yeah,
good.
it looks nice.
It looks really good. I just, and then obviously, like, I've seen the rhinoplasties you've done for a few people, and I think it looks really beautiful.
It looks great.
Very natural.
Thank you.
Like, not fake at all.
Yeah.
Whereas I feel like in some places, everyone comes out with just one nose.
Yeah, I don't do that, seriously. No, I like to make noses that can be for the faces, for the races. That's definitely something I'll not do. I won't give you a nose like anyone else from India.
Yeah.
So that is sure. And in your case, it's subtle. See, we're just talking of...
Like, just like, because it's just...
And your main issue is with the tip and the exposure of the columella from the sides and all of that.
And it's just the deviation to one side.
Sure.
I think oh my gosh, I wanted to talk to you about something. Last night, I was trying to breathe, and one side is very blocked up compared to the other side.
But I did tell you about the spur, the spine that you had.
Yeah.
It was blocking one side. Yeah. So we can address that. Hey, before that, how's your buccal pad fat thing doing?
I don't know.
What do you mean?
I can't tell.
Do you feel anything? Pain?
No.
Do you feel anything different, as in something? I can see a slight, like a hollowing there, if you see.
Yeah,
I told you it's going to exaggerate your malar bones and your jawline.
Yeah.
And it just comes here.
I think a little bit swollen at the moment.
It's a little bit swollen, but I show you with the mirror.
I'll be back in about, I'll be back next week.
When you remove the buccal fat, generally doesn't swell around that. The swelling is from the bony work that we've done on the jaws.
Okay.
So I show you exactly what I'm saying. See this? It's a bit heavy. We can hold on to that. And you see, this is the depression I'm saying.
Yeah.
So it goes in a little bit, so it exaggerates this part of your bone and it exaggerates the jawline.
Yeah.
And you can see it's similar here. If you check carefully your pre-operative pictures, you wouldn't have that depression. It's probably just a couple of millimeters in your case because you also only removed 50% of your buccal pad fat.
I googled it. It said it takes about 2 weeks to see results.
But you can see it right now.
Because I can see
There
it.
is, yes. No, why we say 2 weeks is because you can have swelling. But not necessarily everyone it takes that long. I've seen patients having result immediately. Like in your case, I can see the result.
You can see the results.
Yes, this has gone in. Surely gone in.
Yeah, definitely. There's massive difference
Yeah.
here.
So
Definitely.
you can get your pre-operative picture and we can check it if you want.
Like you all handshake. So I'm being discharged now.
Yeah, they'll get you all things done and help her with the discharge. Okay, bye-bye.